Hello, everyone. Welcome again to the Creating Solutions One Reality at a Time podcast. We are here for achieving unity. That's achieving unity as we harness the power of encouraging, inspiring, and including others personally as well as professionally. This is a picture of my website on the screen. We'll go to that at any time. But again, it's our Achieving Unity Weekly podcast. It is every Thursday in 2024 that we meet. If it's not a U.S. holiday, United States holiday, which is like Thanksgiving or Christmas, any of those holidays, we will not have meetings on those days or podcasts because of holidays. But also, as of January 1st, 2025, we are going to move to Wednesdays. My course on Achieving Unity will be coming in on that Thursday. So hope you will take the course. It's a 7-week course, 90 minutes per week. Would love to have you as a attendee, as a member of that class. But we are from 1 p.m. Pacific time, 4 p.m. Eastern time each week. So what is it? You see my logo in the top right corner. From reality-focused dynamics to the success-focused solutions that we create, contact me today on using Agile and Lean outside of software. A lot of people that understand those words may be more on the engineering side, maybe on the computer software side, information technology, but the philosophy can be used in every discipline, every vertical, including our homes. Agile is the ability to create and respond to change, enabling success in an uncertain and possibly turbulent environment by emphasizing adaptability through better collaboration and communication. Lean is a methodology focused on maximizing value by minimizing waste and optimizing our processes through continuous improvement, effectiveness, and efficiency. Connect with me and I'll show you how to break all products and services down from the most complex projects to the basic steps of training our teenagers. Have you ever told your teenager to clean their room? What do? They get some clothes, toss it in the closet, toss it somewhere else. My room's clean. They didn't quite get the message. Neither did I when I was a teenager. Let me show you how you can transform changing into improving. Changing is short term, improving is long term. We can turn developing into delivery. We can turn that software that we hear about into solutions. One of my speeches, WID, BID, RID, GID. Write it down, break it down, review its dependencies, get it done. That's where we need to be, and we can do that in every facet of our lives. Achieving unity, as I mentioned, through the power, as we harness the power of encouraging, inspiring, and including others. Encouragement can be the strongest power known around the world today, and that power is in the center of empowerment, empowering others. We do that through that encouraging, inspiring, and including others because of our education and our learning. And we can do that with each other. We will be united by achieving unity. We will become a successful team, inspiring one another to achieve every goal, again, by working together. Because that together, we will conquer every challenge to inclusion and celebrate each victory personally and professionally. This is not just for business. This is also in our homes. Are you, someone you know, maybe facing relationship challenges or difficulties with parenting time as a divorced or divorcing parent? I can help you transform frustration into understanding with what the frustration? Demonstrating that anger holds no value. Remember, anger is just actions not gaining effective results. ANGER, actions not gaining effective results. From personal relationships to prenuptial agreements, and nuptials not required. A lot of people are not getting married anymore, but the relationship agreements are important to know before we build that relationship. Life happens, and we can learn to embrace and enjoy every moment of it. Excuse me. Again, you see my title again. Here are the QR codes. You're available. You have your phone ready. Click either one of those. Once our website home, And one on the right's a contact page. Feel free to contact me at any time through email. Our upcoming guest, Agape Garcia, will be here next week talking about the National Domestic Violence Awareness. We have two people talking with me right now on Hispanic awareness. Last Thursday of the month, which will be Halloween, will be on the LGBT history, where it's going, what it's doing, and how we're helping it grow the way it must grow. Maury will be coming to talk to us on Veterans Day, talking to us about COPD. Tara Woodley, talk about the International Day for the Elimination of Violence Against Women. Now, we need to eliminate all violence. We need to start where it's hitting us the worst. And right now, that's the violence against women. We need to work together, mothers and fathers, men and women, male and female. We've got to end violence. Next will be our National Play Day with Dad. Can't forget our fathers. I used to be a member of the Fathers for Equal Rights, FFER in Denver. We need to work with both parents. Also have the bestparentisbothparents.com. We need to work together to end anger. There is no value. Why do we do it? Let's end it, starting today. Well, now, here is my honor of the day. I was just chatting with Dr. Dave. Our guest today is Dr. David Clarke, president of the Psychophysiologic Disorders Association, PPDA. It's a 501c3 nonprofit dedicated to ending the chronic pain epidemic. Now, they may be doing some name changes. He'll talk to us about that shortly. But Dr. Clarke holds an MD from the University of Connecticut School of Medicine and is board certified in internal medicine and gastroenterology. His organization's mission is to advance the awareness, diagnosis, and treatment of stress-related and brain-generated medical conditions. You can learn more at endchronicpain.org. Now, as we get started, in just a second, I'm going to turn the screen over. But Dave's first question is going to tell us, Dr. Dave, can you tell us why organizations like the PPDA need to exist?
Yeah, absolutely, Mark, and great to be with you, and thank you for having me on your program. What we are focused on is actually the biggest blind spot in healthcare. It turns out that most people assume that, and this is the training of most healthcare professionals, that if you've got pain or illness, most people assume that it must be coming from injury or disease. But it turns out there's a whole other category that can cause pain or illness anywhere in the body, and that is brain-generated symptoms, symptoms that originate in the brain and can be created anywhere in the body. Even when there's no physical abnormality present, the symptoms
Wow.
are every bit as real as those caused by organ disease or structural damage. They can go on for years or decades. They can happen to anybody. The traditional diagnostic approach doesn't work because either there's no structural problem to find, or if you do find an abnormality, it's not causing the symptoms. And this wouldn't be such a big deal if it was rare, but it turns out that 2 out of every 5 people who go to the doctor, this is what they have. And it's 1 out of every 5 people in the adult population. So we're talking about 50 million people in the United States alone. And to finally get away from this bummer of information, we've got effective treatment available for this. We can alleviate this. One of my patients, just to cite one example, was hospitalized at a prestigious university 60 times in 15 years for attacks
Wow.
of severe dizziness and vomiting, and they had no diagnosis. A dozen specialists looked at her. She had every test you can think of. A psychiatrist checked her out and said she was fine. But it was all linked to stress in her life. And by bringing that into the open, she was cured in less than a 1-hour conversation.
That's amazing, Dr. Dave. What amazes me most is we're talking to, I think as you mentioned, with well-known doctors, well-known facilities. How is that information not being shared?
Yeah, it's starting to be. I mean, I've been teaching at the medical school where I'm based in Portland, Oregon for several years now. There are medical schools in Europe where I have taught that are teaching this information. I've been teaching in graduate schools for psychologists for over a decade now. So the word is finally beginning to get out. And what's really going to accelerate it is that in the last mostly 3 years, we have had some gold standard science published across North America, what we call randomized controlled trials, which are, the highest level of scientific information that have shown that this new pain relief psychotherapy that uncovers the stresses in people's lives, brings them out into the open, and enables people to recover from those. And that brings the pain and illness down. This is starting to get people's attention. It's been in the Washington Post, LA Times, CBS News, and more professional educational institutions are paying attention to it. So I'm
Wow,
very happy with the way things are going.
thank you for what you're doing. Just as we even mentioned earlier, that information that we know and we live with for so long and we accept, we don't think about looking elsewhere. And that I appreciate you. I know so little about what you do, but I do know about that process of us doing the same thing over and over, and it becomes a comfort level. And there could be a better way, but we don't see it. I appreciate what you're doing.
Well, once you do see it, you can't unsee it. And the doctors that I have taught how to do this approach, they absolutely love it, because all of a sudden, 40% of the people who are coming to them for help with their pain or illness are getting better instead of causing frustration for themselves and for the doctors. We're talking about bodily symptoms literally from head to toe. It can be migraines, dizziness, ringing in the ears, visual disturbances, pseudo seizures, trouble swallowing, fibromyalgia, irritable bowel, bladder spasms, pelvic pain, joint pain, pain in the low
Wow.
back is a big one. And all of these things, they won't necessarily get relief in one conversation, as I did with
Right.
the patient with the dizziness. But even people that take longer to get better, they at least know they're on the right pathway to healing.
Oh, yes. And that would make, I think it'd make everyone feel better from the start. But if you don't mind, Dr. Dave, I'd like to kind of change direction just a little bit. What sparked your interest in psychophysiologic disorders and the chronic pain epidemic?
Yeah, that's a great question. I was, heading toward being a perfectly ordinary gastrointestinal specialist. I was getting the most traditional training that you possibly could for the first 7 years. It takes a long time to learn to be a doctor.
It
Uh,
does.
and nobody mentioned any of this. And I was doing well. I mean, I was successful in my training years. I got an award for excellence in medical school. I got into my dream hospital residency program. I was
Wow.
passing all my board examinations with high scores. So the last thing I expected was to run into a patient that I didn't know the first thing about diagnosing or treating. And this was a woman in her late 30s who was sent to us from another university where they couldn't figure out what was wrong, to UCLA, where I was in training. And she was averaging one bowel movement per month, despite
Wow.
taking 4 different laxatives at double the recommended doses, and they weren't working. And we did some specialized testing on her, and my department chair and I were sure that this test was going to show the problem. That was normal too. Completely left us baffled. And I was doing her exit interview and talking to her about stress, and just out of desperation, got into a pretty wide ranging discussion. And she began to tell me that she had been severely abused as a girl. And I had never heard that from a patient before about their childhood abuse history. I didn't know what to do with it. I didn't know if it could possibly be relevant to her condition. But it turns out that a majority of my patients with these unexplained pain and illness conditions, it can be traced back to some kind of adversity when they were children. And that was absolutely the case with this patient. I didn't know what to do with it. I had zero training in this, but there was a psychiatrist at UCLA that was knowledgeable in this field. And much to my shock, she cured this patient with less than 3 months of weekly counseling sessions. I had no idea that such a thing was
That's
possible.
amazing.
Yeah, it was amazing. That was the elevator ride that changed my career. I'm riding up in the elevator with Dr. Kaplan, the psychiatrist, and just to make conversation, I said, "What happened to that patient I sent to you?" And she said, "Well, I'm not seeing her anymore." And I thought, "Well, of course not. You're not going to be able to cure somebody like that." And she said, "She's fine. She's, doesn't need laxatives anymore. Her bowels are moving normally." And I'm going, "What?" But I felt like if I'm going to be a complete doctor, I got to know at least something about this. So I had Dr. Kaplan teach me her framework for how she thought about this, thinking, okay, a couple patients a year, this might come in handy. It
Yeah.
was 5 or 6 patients a week once I started looking for it. For 2 or 3 decades of my practice, over 7,000 people that I have interviewed along these lines since then, 40 years ago. And the rewards of doing this, I mean, to see people who were at their wits' end get better, sometimes in a matter of weeks or months. One of my patients had been ill with abdominal pains more often than not for 55 years. Volume 3 of his paper chart was 3 inches thick. He was, he didn't think I was going to be able to do anything for him. But a
Right.
month later, he was cured.
That is amazing. Now, that brings me to think I have a close friend that had problems, and we were all just about to think that he was about to pass away. And they put put him on iron pills, I believe it was, and got better, but it was still just a long period of time, weeks. And today he's fine, but we have no idea. Still goes to the doctor, every couple times a month, but have not learned anything about what the problem was.
Well,
Is
if it was cured with iron pills, then um, that's a biological problem. With my patients, you might find something if you look hard enough, but then you do the treatment for whatever it is that you found, and it doesn't help, or that problem improves, but something else develops. These symptoms can move around in some people, or there can be multiple symptoms. Many of my patients have more than one symptom at a time. The key is to go looking for sources of stress. And very often it's treatment of the person as a child in a way that you would never want for a child of your own. And that can be almost anything, but these can have long-term impacts. It can
sure.
it can affect a person's self-esteem. It can cause them to be uh, so focused on the needs of other people in their world that they don't know how to put themselves on the list of people they take care of. They can be very detail oriented or even perfectionist. They're often highly self critical. They often can get triggered by people or situations in their present day life that connect in some way to their childhood experience and are therefore highly stressful for them. So lots of different stresses that can crop up, but when we uncover them, when we bring them out into the open where we can talk about them, we can almost always intervene successfully, bring the stress level down, and then people's symptoms begin to improve,
Well,
and sometimes dramatically.
that's awesome to hear. I mean, and that's kind of what I'm talking about with this close friend. I don't know, like you mentioned, did the iron injections weekly and almost like an infusion. Had to go to the hospital and be on the IV, and he got better, but his iron now is not much different as far as when he goes to the doctor, the measurements. So I guess I'm just still confused. Was he cured, or did psychologically
Yeah, I would have
he
to
improve?
probably
Of course.
see the medical records on somebody like that. I mean, I've one of my patients who was somewhat similar had celiac, which involves harm to the lining of your intestine because of compound that's in wheat gluten and certain other grains, and causes inflammation in the lining of your bowel, which then doesn't absorb nutrients very well. And one of those nutrients can be iron, and people can get low iron related anemia from that. So that's a pure speculation about this,
Right.
but you can get symptoms and pain that's every bit as severe as that caused by these organ diseases or structural damage, purely from the brain creating symptoms in the body. It's astounding the power of the brain to do this. I mean, I told you about the person who was had stomach pains for 55 years. Another one of my
55 years.
Another one of my patients, I was asked to see on, I was a teenager, had been in the hospital for 70 days when I was first asked to see them. And they were getting morphine around the clock in high doses for abdominal pain that was unexplained. 6 other gastrointestinal specialists had already seen this patient over the previous 18 months with no diagnosis. And this was 100% due to stress, because when I uncovered what was going on and was able to intervene successfully, the patient started reducing the opioid dosages and was able to leave the hospital in a week. And 30 days after we met, was able to stop all of the pain medication completely.
That's amazing. That is, again, I know you're on the show. I'm pinpointing on you, but thank you, because you are opening up. As I talk about achieving unity through that power of encouraging, inspiring, including others, what you're doing is opening up so much in an industry that, in a vertical, the medical industry, that for us, the lay people are saying, well, you should have already done that. You should have already explored that. But it's like you're opening up another door to this very complex system that we do have within the brain, the heart, to our blood system. It's amazing. But let me ask you something else, because you brought up a couple of times things that have happened, trauma from our childhood. Well, what about trauma even in our adulthood?
Yes, absolutely. And those are things that I look for as well. People can have the disease depression, for example, and not fully recognize that they have it. They can have an anxiety disorder and not fully recognize that they have it. It can manifest more in the body than it does in mental health symptoms in many cases. So we have to be alert to that. But you're absolutely right about the trauma. A colleague of mine, we just had a big conference in Colorado, and he's from Tucson, and he came to the conference. And a year or so ago, he told me a story about a patient who had been going from doctor to doctor trying to get relief for symptoms that had been going on for close to a year. And he was the one, because he knows this approach, he was the one who found out that right before her symptoms began, she had been a hostage during the robbery of a store. And she spent
Wow.
40 or 50 minutes with a handgun pointed at her neck. And,
Wow.
obviously a huge trauma. And this had taken place right before the onset of her symptoms. So there was no question, after they looked for biomedical and physical causes for her symptoms and didn't find anything, there was little doubt that it was this trauma that led to the symptoms. But if you don't know to look for that, and, when I was in training, they didn't teach us to look for these things. The assumption about patients like this is that they're neurotic, or they can't handle their own stress, or that they're imagining this, or it's all in their head, or that there's nothing we can do for them. And none of that is true. I mean, this is something that can happen to anybody. I don't care how mentally strong you are. If you've
I
got
agree.
enough stress going on for a long enough period of time, you can get these physical symptoms. It's a
Mhm.
biological fact.
We can hear this, we just have to let it go. Well, that sounds good, but it's not that easy. And going to a professional like yourself can help people truly let things go. Your services and the people you talk to, the person that got you into this, can truly take you to that next level. So
Yes.
that,
And, a good place for your viewers to start actually is on the website endchronicpain.org. We have a 12-item self-assessment quiz there. Takes less than 3 minutes to go through it if people are wondering if they might have this themselves. And each question has a very short explanation with it so that you can understand why we're asking the question and what the result means. And we've set it up in a way that the more of these 12 questions to which you answer yes, the more likely it is that your symptoms are coming from this brain to body mechanism.
mhm. Yes, it is. It's amazing. I can't keep up with it. I'm just so glad that you are. So it's amazing. But that brought up another point as you were talking. What are some of the misconceptions about chronic pain, particularly when it's relating to stress?
Yeah, the
What
biggest,
are some of the misconceptions that maybe you run into or encounter, or for me, what are some misconceptions?
well, the biggest misconception is that it's somehow not real, but all pain is real. And all pain is actually generated in the brain. If you burn your finger on the stove, it's your brain that is deciding that the damage signals it's getting from your thumb need to be interpreted as painful, so that you're going to be careful of your thumb. You're going to take care of it. That's what the pain is all about. It's a signal that a part of your body is in danger and needs to be cared for. There's no such thing as imaginary pain. If you're having pain, it's real, and it's coming from a real source. And we need to track that down, whether it's a hot stove or whether it's a long-term stress burden that you've been carrying sometimes for years. My personal record patient was 87 years old, and she had been experiencing abdominal pains since the age of 8. So, if you do the math, a total of 79 years of abdominal pain. And she was a nurse, so she had, very good access to healthcare. She got, all the diagnostic tests you're supposed to have in that situation, didn't show a darn thing. Um, but she had been through a trauma when she was 8, and we talked about the trauma. We talked about the burden of guilt that she was carrying from that. We did some work to help her alleviate that guilt that she didn't even recognize how the magnitude of this guilt that she was carrying. And once she did that, she got better. Um, One last misconception is that if the doctor does find something wrong, it must be responsible for your pain. And that's actually not true either. It can be
Mm.
that it's just what we call an incidental finding. There's an abnormality there, and there's a pain there, but the two are not connected. And this happens most often in the spine, because it turns out they've actually done studies where they've X-rayed or done MRIs of the spine in people who feel fine, people with no pain at all. Their backs are perfectly okay as far as they're concerned. And you do the magnetic resonance imaging or you do the X-ray, and lo and behold, you find abnormalities in people who feel fine. And the older people are, the more abnormalities and the more serious abnormalities you find. Once again, people who feel fine. So when somebody develops stress-related back pain and they go into the doctor and they get the imaging study, the X-ray or the MRI, and the doctor finds, oh, you've got this disc issue or you've got this vertebral bone issue. Well, very often those are the same abnormalities that are found in people who feel fine. So why would they be causing pain in one person and not pain in somebody else? And very often the reason is that the person with the pain is also the person with the stress. And
Wow.
they did a study recently of 222 people who were coming to a clinic for their back pain. And it turned out when they did, very careful evaluations, both of the spine and of their stress levels and of their symptoms, they found that 88% of them, it was not the spine.
88%.
88%. And this absolutely dovetails with the fact that when surgeons operate on the spine, or do injections of the spine to alleviate pain, the success rate is about 25%. And that's why, because about 12% of the time, there is an abnormality in the spine causing pain that will get better with a surgical or injection intervention. And then there's another 12% that get better because of the placebo effect. And then the other 75% who have had an injection or an operation, they're not getting better because the real problem is the brain is generating their pain.
It's still mental.
Yeah.
Interesting. Okay, now I just as you're talking, just kind of made me think. And I had a car accident when I was 18 years old. I just got out of high school, went off to college. I was riding with a friend, and the front left tire, what I'm telling you here is what I was told, but front left tire of the pickup truck blew. When it did, it pulled us into a ditch. We hit the ditch, and when it did, I went through the windshield.
Oh,
I've got scars on my hand here still, scars on my hand, 3 huge scars on my head, on my chest, on my back from that. And I went to intensive care. They had to fly me 60 miles north in a helicopter, which I don't remember. Um, but I'm sure that had something to do, some major impact on my spinal cord. And we hear about, now it's a one-time thing, but it's a pretty dramatic. And we hear about football helmets now and how much money and time we're putting into better helmets for the football players and things like that. But I'm one of those people that I don't have any problems that I know of. But what is this something now I've been to a chiropractor, I've had x-rays since then, but is that something that not just me, but people that have accidents or something like that, should they be tested? Should it be looked at?
no, what we're talking about here is that most acute injuries to the body will heal in, roughly 6 weeks. So that the
Okay.
spine goes back to being in good shape. And if you've got pain, in order to do a thorough evaluation of somebody, it's important to check them out for brain-generated pain or illness by assessing for stress and doing what I call a stress evaluation to make sure that that isn't at least a contributing factor. So when somebody's got pain in the spine or anywhere else, if there's not an obvious structural cause, physical cause, biomedical cause, in order to be thorough, in order to be complete in the medical evaluation, we need to find out, are you under any stress in your life at the moment? Is there a linkage in timing between when your symptoms began and when there was a big stress in your life? If there's fluctuation in symptoms, do they fluctuate in relation to stress in your life? We need to check out for depression, anxiety, or trauma, as we've mentioned. That's part of the stress evaluation too. And then the biggest surprise to me in my training was we need to check you out for, were you under stress as a kid? Did you experience things that you would never want for a child of your own, or that would make you sad or angry if you saw them happening to a child you care about? And because those can have, we can't go back and change those, but they can have long-term impacts that we can address. They can affect personalities in stressful ways. They can cause unrecognized emotions, especially anger or fear, that can be expressed in your body that you may not be consciously aware of. And they can cause triggers where, let's say, like my patient who was at the prestigious university 60 times, her episodes were all triggered by interactions with her abusive mother. Even as a 50-year-old
Wow.
woman, 50-year-old woman whose mother was in her 70s, the negative impact of that patient's mom was so bad that it was making her physically ill, but she couldn't see it. She had been burying her emotions and her stress around her relationship with her mom so thoroughly since the age of 3 or 4 that she had no conscious awareness of what her mom was was impacting her with.
That's amazing. But it fits in. And that's one of those things, Dr. Dave, is as you talk about this, it all makes sense. And the medical industry is so technical, and there's so much to our DNA and our bodies and how our mind works, the neuro. But yet, when you start talking about some of these issues with I think you said 7,000 people that you have seen, and to be able to bring all of that knowledge together, and then you talk to a layperson such as myself or anyone in the audience that's listening, what you're talking about just seems to make sense. And well, why didn't we see it sooner?
Well, there have been a few doctors who have seen it over the years. Even going back to Roman days, there was a doctor named Galen who observed this kind of phenomenon in his patients, and there have been a number of others over the centuries. But we can go all the way back to an Egyptian papyrus of 1800 BC, where these symptoms were first described. And the treatment that they recommended, of course, was not particularly good back in those days.
Right.
But what's embarrassing is that the treatment really hasn't improved for most people, even to this day. We finally, in 2024, we've got several gold standard research studies, as I mentioned earlier, from across North America. Halifax, Harvard, Detroit, Boulder, Colorado was a great one. The Los Angeles VA has done some excellent work. All of them showing that this new form of pain relief psychotherapy, that I call it, that I've been using since the 1980s, just how effective it is. The Boulder back pain study was a great one. Because it had 2 control groups. They did the pain relief psychotherapy with 50 people who had had back pain for an average of 10 years. And the other 2 groups, one got an injection and the third group just got their usual care that they'd always been getting. The pain scores for all of them were about 4 out of 10, which is, pretty significant pain, especially if you've had it for 10 years. The pain relief psychotherapy group, in 1 month, the pain scores dropped from 4 to 1.
Wow.
And 2/3 of them, it was either a 1 or a 0. So just, after 10 years, it drops like a stone like that. And then just to be sure, they followed them for an additional 11 months, and the pain scores stayed the same. And the other 2 groups, even the one that got the big injection into the spine, which is a powerful placebo,
Yes.
those groups did not improve. It was only the psychotherapy group that got the significant benefit. And the magnitude of the benefit was something that had never been seen before from psychological treatment of chronic pain. It was just dramatically effective. And now those results have been found by other researchers, completely independent from the ones in Colorado. And these are the Harvard and UCLA and the university in Halifax, Nova Scotia, and in Detroit as well. So all of these are confirming that when you take this approach, you can alleviate chronic pain and illness far better than we've ever been able to do before.
You heard me say "wow" several times in this
I'm
conversation.
saying wow. When I first saw those results, I was going, "Oh my God!" There's even another piece to it, Mark. They scanned the brains of people who were in chronic pain before and after they got the psychotherapy, and their brains anatomically changed on the scans. The
Wow,
psychotherapy was actually causing the circuits in the brain that were responsible for this very real pain to physically change. Again, just by talking to people in the right way, just by uncovering these highly stressful issues in people's lives that had not been addressed in the past.
Okay, one of the questions is kind of my next question, and you're touching on it because you're touching on a lot of things, but and I think you somewhat answered this, but to be a little more direct, what do you find to be the most effective treatments for chronic pain that's linked to stress and mental health issues? Is that
Well,
something you can talk about, or?
yeah, for the simplest ones, we definitely want to uncover anything that's going on in your life right now. One of my patients, he only got his pain when he was driving to work. When he was driving home from work, he was fine. Also fine on the weekends when he was not on the job. And that made it pretty obvious that something stressful must be going on in his workplace. And sure enough, there was. We don't need to go into all the details, but by helping him deal with that more successfully, stress level came down, symptoms went away. Another patient, unfortunately, was suffering domestic violence. The person she was living with was beating her up 2 or 3 times a week. This had
Sad.
been going on. And I know you've got some guests coming up in your show in the very near future on this topic.
Correct.
And it can lead to, no surprise, stress-related physical symptoms. And this woman's pains had been going on for a period of time, exactly corresponding to the duration of the violence in her home. So with the help of a social worker, we got her out of that environment into her own apartment, ended that relationship. And within a couple of weeks, all the pain went away. So, those are very, very simple. It's a little more complex for people who are suffering the long-term impact of adversity in childhood. I focus on the personality traits, perfectionism, um, lack of taking time for your own joy, not putting
Mhm.
yourself on the list of people that you take care of, low self-esteem, poor assertiveness, excessive self-criticism. If people can see what it was about their childhood environment that led to the development of these traits, if they can see what it was they learned from their childhood environment that isn't true, assumptions they made about themselves back then that they're still carrying with them. For example, that it's their job to solve the problems of everybody else in their
Right.
world, that they've been doing since they were kids because that was the environment they were in. And kids try to fix things when they're not happy. And if you learn that to try to fix things, even amongst the adults in your household, as a young kid, you're going to grow up to be somebody, no surprise, that tries to fix other people's problems.
Mhm.
And you can end up on a treadmill you never step off. You can end up feeling like you don't have the right to do some of that same thing for yourself, put yourself on the list of those you take care of. So those are approaches. The buried emotions, that's probably the most difficult and subtle of all. If you've got that in a big way, a psychotherapist who is skilled with those is likely going to need to come into play. But a lot of my patients, what has helped, one single technique I can share that helps a lot is to imagine yourself a butterfly on the wall of your childhood home, and you are watching a kid that you care about try to go through everything that you went through as a kid, even just for a week. And again, it's not you living your life, it's you're watching a child of your own or a child that you care about try to cope with everything that you had to cope with as a kid. And as people imagine that, the emotions start to bubble up. And a lot of times it's emotions that they've never let themselves feel before. And
Mhm.
once they're in conscious awareness of those emotions, they can start to talk about them. They can start to write things down about them. They can write in a journal. They can write a letter to the people who mistreated them, not to mail it, just to write that letter and put all those thoughts and emotions down. And again, they keep that to themselves afterwards. And the more they can put this into words, change those emotions from feelings in their bodies into words, the bodies begin to feel better. Very powerful technique. Frequently not the only thing that they need, but
Right.
it can go a long way. Just something as simple as that.
It's the seed, is what I'm hearing you say, Dr. Dave. It's a seed that's planted to help them to grow beyond some of those areas. And I think you heard, or I think you heard, as I mentioned at the beginning of the program, I coach a lot of people. And when I hear people talk about our childhood issues, and love you to touch this a little bit more. I think you talked about it just a few minutes ago, but again, we have a lot of people that are always saying they're trying to please everyone and they know it, and you try to help them to stop trying to please everyone. And sometimes even in a parent-child relationship, the child is not giving the parent the respect the parent, I feel, does deserve. I think parents do deserve respect. And some of that is creating stress for them in the process. So it's not necessarily childhood trauma. There's more and more, I think, adult trauma that we may be encountering today. What are your thoughts on that?
Yeah, we're definitely living in a highly stressful world. And, in order to cope with that world, we need the ability to take stock in ourselves and what we're feeling, and be able on a regular basis to have the rest of the world just kind of go away for a little bit and take some time for ourselves. One of my patients, and this is a good example, was I saw her for the first time in the emergency room early in the morning, where she had been all night long for a sudden attack of abdominal pain. And they had put her through all the tests and everything was coming back negative. So I'm talking to her about her life, and she was very, very busy. Let's put it that way. She worked full time. Her husband worked full time. She was also busy with coaching her daughters in a particular sport. She was coaching other people's kids in that sport. She was driving them to out of state competitions. She was on the athletic club board of directors. It just never stopped for her.
Wow. Yes.
Now, why was this? Well, it turned out that she had been a champion in this sport as a girl. But in order to achieve that, she had to practice her sport before school, after school, and on weekends from the age of 4 onwards. She never really got to be a kid, never acquired the skill and the experience to be able to just play. Children need to play, and if they don't learn the skills they need for self-care. And consequently, as adults, the idea of telling the rest of the world to go away and taking some time for your own joy kind of becomes a foreign concept. And people feel guilty if they do that. If they've got 10 minutes of free time, they're not thinking about, okay, I'm going to flop down in the recliner, grab a beverage, and do something fun like read a book I've been wanting to read. They're not doing that. They're thinking about, oh, look, there's dust bunnies in the corner I need to clean up. There's dishes in the sink I need to do. I need to call my neighbor who needs some support. It's frequently nonstop for them. So I'm trying to teach them, and this is another therapeutic technique, to carve out regular space in your life, at least once a week. Try to get a couple of hours where you do something that's got no purpose but your own joy. What we're looking for is the moral equivalent of finger paints for a 4-year-old. 4-year-old doesn't care how many pictures per hour they produce. They don't care about the quality of the work or who sees it. They just know they're having fun. And that turns out to be an essential human skill. We all need that.
That is so true. Thank you for bringing that forward. That's something that, again, as we've talked about, some of these things we know, but we don't do them. Like you said, that even that letting things go. And yes, the neighbors you mentioned might need some help, but help myself first. And another example that hopefully we hear a lot is the airplane story, that when that oxygen mask comes down and you have children with you, who will you put the mask on first? Well, it's yourself. Because if you can't take care of yourself, you have no benefit to the children, right?
That's exactly right. Yeah.
Yeah.
You have to be in a good and stable place yourself if you're going to help others to the maximum extent.
Mhm. Great. It's a great subject. And I don't think you want to be on here for 72 hours, but I know I could talk with you for a lot longer.
That
But
would
let
be
me touch.
stressful for me, Mark.
I like that. Good humor. That would be stressful. Well, we talked just briefly at the beginning, but how is the PPDA helping to educate healthcare professionals about some of these illnesses related to stress?
Yeah, we're actually in this is where the name change comes up. We just decided, my board of directors and I, to change the name to the Association for Treatment of Neuroplastic Symptoms. And neuroplastic means that nerves, which includes your brain, have the capacity for change. The plastic word in medical jargon means the ability to change. And we think that's
Okay, thank you.
a hopeful message. So neuroplastic symptoms are these brain generated conditions, pain or illness, not connected to structural damage or organ disease. And that's the mission of the nonprofit, is to spread the word about this to both the public and the professionals, how to diagnose and treat this condition successfully. People who are suffering from this, fibromyalgia, long COVID, lots of other conditions, can do a lot for themselves. There are science-based books on this now, including my own, which is called They Can't Find Anything Wrong, and a textbook for professionals that's written in plain English, so everybody who's interested in the science can read this, and that's called Psychophysiologic Disorders, blend of psychology and physiology. We have sponsored 3 documentary films. We had a huge conference in Boulder, Colorado last week. 270 people from all over North America and Europe attended that for 2.5 days of lectures on the latest science and therapeutic techniques. The website has got a membership program. People support us as members, and they get a special self-treatment course that's designed for them. They get access to monthly Zoom Q&As, just like the one we're doing right now, where people can ask questions of experts live on Zoom. And we're coming up in 2025 with a new podcast that's going to be educational and therapeutic for people. Lots of new developments, and plus I do lots of podcasts, broadcasts,
Thank you.
print journalism. We are reaching out through every channel we can think of.
That is excellent. And for us to go to your website, do you have a quick way
Yeah,
to help?
endchronicpain.org is going to be one that we keep even after the name change. And we're going to have another one, a new one that's going to be released probably next week, as a matter of fact. So if you go to endchronicpain.org next week, you will very likely see the new website, which has a new name. I won't reveal it right here and now, but people can check it out. It's going to be completely different and have a much easier pathway toward gathering this information.
The inchronicpain.org was in the introduction. Go to that one. That's great. What do you feel is our best next step? What do you like? As you mentioned, the PPDA, the new title, and I'm glad you explained what plastic meant, because I was confused, I guess, when you first talked about plastic. But some of the next steps, how would you, for example, advise patients who are dealing with unexplained chronic pain or maybe stress-related symptoms? What would they do? Is there?
Yeah, if your viewers are wondering whether they might have this condition themselves, a great place to start is with that self-assessment quiz, less than 3 minutes, and you can get a lot of information about whether these ideas might apply to you. And then if it seems like they do, then we've got lots of resources. We've got books, we've got courses. As I say, we have the membership program. We've got Q&A via Zoom. We're going to do one for the public. You don't have to become a member to sit in on this one. It's going to be late November. You can find the exact date on our website. So lots of resources there. We've got a practitioner directory where people can
Oh,
look up
excellent.
and find people that have taken special training in this field to be able to help people with this. Um, and for any clinicians out there who are wondering about the scientific basis for all this, we have a bibliography of over 200 published scientific references that support the recommendations that we make.
That's excellent. So if I were to encounter someone, and I am not a doctor, I'm not a lawyer, I don't give legal advice, I don't give medical advice, but if I were to see someone that maybe I thought maybe had that chronic pain, and would sending them to your website be the best first step? What good news, what good information could I give them for them to do next?
Yeah, a lot of times when you bring this up with people that, even some whom you might know well, they tend to be skeptical because we we haven't learned as a population just how ill you can get from the brain creating symptoms in the body. It's still a new concept for a lot of people, and the idea that your brain can create these profound levels of change, profound levels of pain that can go on for decades in some people.
Right.
It's just um, seems implausible to people. It seems like it couldn't be possible. It seemed that way to me when I started out. That your brain could make somebody's bowels shut down to where they're only
Exactly.
having one per month. I mean, that just come on now. That can't be right. It was
Uh,
right. Or another patient of mine had a completely paralyzed stomach. We did the test, and this person's stomach was not moving at all. And I know that it was stress related because once we uncovered the stress, he was cured. His stomach went back to normal.
uh,
So that's a barrier for a lot of people, and they think when you're mentioning this that you're looking at them as though it's all in their head and they've got some kind of neurosis, or they're mentally too weak to handle their own stress. So um, what I try to say to people with those concerns is just go to the website endchronicpain.org, find the self-assessment quiz, go through the 12 questions. It'll take you less than 3 minutes, and you're going to get some perspective on this condition and on yourself from that. And if you go through the 12 questions and you say, nope, this is not me, that's okay. You've only wasted 3 minutes. But
okay.
if you're getting a lot of yes answers to those questions, then you can take the next step and look at our resources. And um, all you're doing is making your medical evaluation more thorough than it was before.
Thank you so much. I have a couple more questions, but we are at time. I don't know if
Okay.
you have another few minutes or not,
Oh my
but
goodness, we ripped through that hour in no time, Mark.
I
Yeah,
know I was just looking at my clock. Uh,
if you have questions, Mark, fire away because probably your viewers do as well.
okay, well, the first question, and I'm hating to give this comparison, but it does strike me because of some of the other work that I do. Divorce industry in our judicial system. It's terrible. And the thought of what we're doing, and we are doing it, changing things like visitation to parenting time because no parent is a visitor in their own child's life. But just things like that. What you're talking about here, how does that impact the medical industry? Is that a roadblock in what you're sharing, that there may be other solutions that we're not viewing because it's not an accepted practice?
Um, the insurance companies love this because all of a sudden you have patients who are getting test after test and sometimes, injection treatments or surgery
The
even.
cost.
It's, that patient who was ill for 55 years that I mentioned, he had volume 3 of his chart that was 3 inches thick. I just always go back to the number of healthcare dollars that chart alone represents. And then you multiply that by 50 million people in the United States alone.
Unbelievable.
It's a couple $100 billion
Billion, that's a
at
B, right?
least, right? And we have an approach that now has gold standard science to document its effectiveness that can alleviate these symptoms in people. And if I'm an insurance company, I am absolutely wanting to pursue this. If I'm a physician, I want to pursue this because now all of a sudden 40% of the people who are coming through my door who would formerly make me want to beat my head against the wall because I didn't know what to do for them. Now I get a very rewarding experience. I mean, sometimes the best medical instrument is a trained mind. And when I
Oh, so true.
when I cured that patient who'd been hospitalized at the prestigious university 60 times, cured her with a 1 hour conversation, you can't get any better than that as a physician. It was just such a rewarding experience. It happened almost 40 years ago, and I still remember it like it was yesterday. The patient, looked up at the ceiling and said, "Oh my God, I can't believe this," because she had a light bulb moment, realizing the impact that her mother was having on her physical health. So, yeah, when people find out about this and when they see that it's backed by science, they embrace it. And I think we're close to a tipping point where it's going to get adopted all over the place. There are already two for-profit companies that have trained a bunch of therapists to do this work that are marketing themselves as a solution to medical insurance companies. And they are both growing like gangbusters.
That's great to hear. That is great to hear. Dr. Dave, maybe we can meet again at the first of the year, maybe the first 2025, January, February, March, first quarter. Let's talk again. I'm interested in this. Let me know what I can do to help you. But do you have any closing comments before we sign off today?
Just for your viewers, that there's tremendous hope here. That people who have been so frustrated. We had a Hollywood film director who came to our conference a couple of weeks ago to make a video for us. And the reason that she volunteered to do this is that she had had long COVID for over a year. It was so bad, she was bedridden. She had to crawl
Over
from
a year.
from her bed to her bathroom and back. That was all she could manage. And then she found, the approach that we've been talking about here today, and she's back to her old self. And she was so grateful that she came out to our conference and she filmed 110 people, both clinicians and scientists and patients and therapists, and and she's going to put it all together into a video for us, just out of sheer gratitude for her recovery. So for your viewers who are suffering from this, there is hope.
So pretty much anyone that has been going to the doctor for an extended period of time has not found an expected possible relief pattern, they should go out to endchronicpain.org and start looking at another path. Is that what I'm hearing?
Yes, I mean, no physician can responsibly guarantee any kind of
Right.
outcome. But if you have pain or illness and there's not been a structural abnormality or an organ disease to explain it, or if the doctor does think they've found something but the treatment is not working as they expect, then to get a thorough evaluation to make sure that this whole category of illness that's so common is not missed, it's absolutely worth checking out.
Excellent. That's such good words to hear. Dr. Clarke, thank you so much. Again, that's at www.endchronicpain.org. It's been an honor. Dr. Clarke, thank you so much for being here. It's been so appreciative, and hope we will stay in touch. Everyone else, I'm Mark Intrican, achieving unity through the power of encouraging, inspiring, and including others, personally and professionally. Hope to see you all again next week. Thank you all. Cheers.